Rosemary Mackenzie, CEO, Mellow Parenting. Mellow Parenting is a small government-based charity with international reach. We research, develop and implement parenting programs for the more vulnerable members of our society, the more vulnerable families that are out there who need support. We do this by providing workforce development training to everyone basically who delivers one-to-one support, group support to struggling families basically. All our programs are evidence-based. We have a number of programs for antenatal, for mums to be and dads to be. We have mellow mums, mellow dads. We have babies and toddlers. We've also got another new program which is called Mellowability, which is particularly for families who have children with special needs. Between the ages of 4 and 7, I would say the transitional period between the child leaving nursery and going to primary school. We also have a programme for adults with learning difficulties and disabilities. And finally, we have a kind of preconception programme for young people between the ages of 14 and 18 called Mellow Ready. Mellow Parenting had to close offices on the 19th of March. We had to do a risk assessment, seeing what equipment we had that we could give to staff to allow them to be able to work from home. We had to cancel all our planned training from the middle of March through to the end of this year, which has had a direct detrimental hit on our training income. Although we're a registered charity, we do operate on a social enterprise basis, whereas 55% of our income is actually generated from selling our training programs. And of course, as a result of all them being cancelled, we've lost income. So all staff are working from home. We're very fortunate to get a small grant from Awards for All National Lottery to upgrade our Mellow technology. So we're all working with the same brand new laptops, docking stations and monitors, which does ease a lot of the kind of initial irks about not having the same online programs to be able to discuss through. So we're all quite averse with Zoom and Microsoft Teams now. We've put together a guide to using online platforms in a bit of a fun style. We have also had to support our practitioners who have been delivering groups to set up online holding groups. We've always believed that Mellow Parenting, because it's all about relationships, these programs can't possibly be delivered online. But now, after discussion with our staff, trainers and practitioners, doing nothing is not an option. We have to do something. So what we've done is we've created a facilitated online group for our antenatal programme, a facilitated online group for our babies programme, and a facilitated online group for our Mellow Ready Young People programme. We are evaluating them as we would normally do, and we hope to be publishing some of the early evidence that we've got that proves it is working, and the participants are appreciating that we're trying to create something online. It's not as good as actually being in a face-to-face group with the trusting implications. But as I said before, doing nothing is not an option. Well, within the first week or two, when the Resilience Fund came out, I put an application into that. Now, to understand Mellow Parenting, we have had some financial difficulties over the previous year, or the previous 2 or 3 years actually. This last financial year, we have made a very conscious effort to reduce overheads, to reduce staff costs. Some very difficult decisions have been made, with the outcome that not only did we reduce our deficit last year, we've actually managed to create a very small surplus of about 40,000. It's not much, but in our view, it was phenomenal. The work that we've managed over the past year has just been incredible, with a smaller team, smaller office space, etc. But whilst that was a wonderful achievement, it actually negated our application to the Resilience Fund because they felt that we had too much reserves. We have 7 months reserves, and I am aware that, as a charity, that's quite a lot of reserves. But at the end of the day, to look at all the hard work that has been putting into reducing our deficit, it just felt a bit of a low blow, actually, to tell us that we had too much in our reserves. So we didn't get that. We eventually applied to the Glasgow City Council rates. We haven't heard back if we've got that or not. It's now sitting at about 8 weeks, so we haven't heard. We did get that nice little grant from Awards for All to increase or upgrade our technology. And we've also had a lovely little grant from the Glasgow Social Enterprise Network to allow us to purchase and install a water heater into our unit, because we only had cold water. To have some wall-mounted alcohol-free hand sanitizer units, and to get some screens between the desks that are slightly closer than some of the other desks. There are only 6 of us, but we want to be a responsible employer and take cognizance of all the fairly significant health and safety requirements that we now need for COVID. We are having ongoing dialogue with our workspace. We are tenants of a workspace, and they are also struggling. We've requested that they do some deep cleaning and maintain the toilets and the communal areas of the workspace before we go back to work. But I don't know how well that's being received. Okay, what we are doing as a staff group is we are meeting weekly on Zoom or Microsoft Teams. We have developed the online antenatal programme, but as well as that, we've also developed the programme manual for practitioners, a participants logbook, which is new to Mellow Parenting, which means that the participants log their feelings, their thoughts and their actions from week to week or session to session. And at the end, this logbook acts as a memoir for their own special time in the group. And it's something that we have thought about doing, but we've implemented it for the online groups, and we will also implement it for our offline face-to-face groups in the future, because it is a direct benefit for the participants. As well as that, we're also developing online training. Now, this is something that we've never done before. Our training has always been done face-to-face. Again, I go back to our strapline, all about relationships. How can you possibly deliver groups? How can you possibly deliver training online? Well, we're getting to grips with it. As part of the award to increase our technology, we also subscribe to Mentimeter, which is a kind of online learning tutorial. We can have interactive quizzes, polls, discussions, PowerPoints and videos. So the first training session is scheduled for the 1st of July. We're all kind of sweating it, but it will be good. I've got great belief in my staff and my trainers that it will be good. So as well as that, that's the development of 3 programs, the development of 3 manuals, the development of 3 participant logbooks, the development of 3 online training programs, bearing in mind that normally a Mellow Parenting program from initial onset, development and implementation to reach a good firm evidence base takes about 4 years. I think to achieve what we have achieved in 2 to 3 months is pretty phenomenal. With such a small staff base. We do work in partnership with quite a few organisations, but we are more there to support the staff of other organisations who have attended our training. So we're there to offer reflective consultation. That normally takes place face-to-face. Now it takes place online. We support practitioners with evaluation methods. They submit our data, the pre-group and post-group data to us. We crunch the numbers and we send out reports to them as well. We haven't been directly working with other organisations, but we've been supporting other organisations. For example, Fife Gingerbread, we're going to be supporting their practitioners doing the New Bumps and Babies programmes. We're also going to be supporting Project 3D in Drumchapel. We ourselves are going to be delivering a group in London online from Glasgow. So whilst not true partnership, it's more supporting work that we will be doing. Okay, what we're doing is, from the very beginning, we decided to do a mini Facebook campaign, so to speak. So Mondays is Mindful Monday, And every Monday we put up a mindful exercise. It can be for parents, it can be for children, or it can be for practitioners who support the families that we support. Tuesday is Talking Tuesday, where we have open sessions for practitioners to call in, phone in, Zoom in, email in for some reflective consultation or just general discussion on how they themselves will be able to deliver our online groups. Or if they're worried about their accreditation process, we're there to talk to them on a Tuesday. Wonderful Wednesday is more again for the children and the families. We have various activities that we upload to our Facebook just to encourage some family interaction. Last week we had Milo making a little butterfly out of cardboard and toilet roll tubes. Cheap, easy to make, and quite fun activities. Thursday is Thirsty Thursday, where we pop up some information for practitioners. This week it will be our guide on using video platforms, comparisons. It's a bit of a fun guide comparing them all and how practical they are for different situations. And then Friday, we all calm down and it's joke day. So TGI Friday, and it's a joke day on a Friday. To keep our practitioners more up to date, we have a 6-weekly newsletter where we document all the actions that we've taken over the previous few weeks. And again, how they can contact us, how we can support them, and how they can deliver the new online programs.